The prevention guidelines are the translation of the science that tells us what are the kinds of things that doctors should be doing to help their patients prevent cardiovascular disease. These guidelines provide guidance to healthcare providers on how best to think about and counsel patients about prevention. There are some new things in the guidelines, the prevention guidelines. One is that there are some overarching themes that frame the guidelines. One being that living a healthy life is the best way to prevent cardiovascular disease. Another overarching theme is the idea of a team-based approach to the delivery of clinical preventive services. In other words, it's not just the physician, but it's everyone on the team that can play a role. A second part of that is paying attention to the social determinants of health. So example, if you're telling somebody that it would be a really great idea for them to be more physically active than they are, but they live in a neighborhood where being outdoors is not very safe or just very difficult, the advice might need to be different for that patient. Still to be physically active, but not about doing it in one way versus another. These guidelines are A, the reminder that there is science about how to promote health and prevent cardiovascular disease. B, that the opportunity to do better is an opportunity to extend lives and keep people from having pretty terrible things happen to them. And that 3, the American Heart Association continues to stress how important it is to promote health and to think about the context of people's lives, the social determinants of health, in achieving that ideal cardiovascular health.